So you've recently had cataract surgery, and now you're wondering, what's the deal with sunglasses? Well, in this explainer, we're going to give you all the clarity and confidence you need to protect that amazing new vision of yours. Let's dive right in.
First things first, let's tackle the problem. We need to understand why everything seems so dazzlingly bright all of a sudden.
For years, you've been seeing the world through a lens that was cloudy, maybe a little yellowed. That was your cataract. Now, your new crystal-clear artificial lens lets in all the light your eye has been missing out on. It's really a combination of three things happening at once. First, you've got some temporary inflammation from the surgery itself, which naturally makes your eye a bit more sensitive. Second, there's that incredible new clarity we just talked about. And third, your brain just needs a little time to catch up and adjust to this new, brighter normal, which can temporarily make you less tolerant of glare. So here's a really crucial point. Sunglasses aren't some kind of magic pill for faster healing. Nope. Their main job is simply to keep you comfortable and to protect your eyes while they're in this sensitive, vulnerable healing phase. All right, let's move on to the solution. We're going to build your ultimate sunglass toolkit, and we'll focus only on the features that genuinely matter. Okay, if you only remember one thing from this whole explainer, please let it be this: UV 400. You need to look for that label or one that says 100% UV protection. It's what blocks all the harmful UVA and UVB rays, and it's absolutely critical for your eye health in the long run. Now let's talk about the tint. How dark should the lenses be? There's this common myth that darker is always better, but that's just not true. The UV protection is actually a totally invisible coating. The tint, that's just for comfort, to cut down on glare. A medium brown or a gray tint is usually perfect. It'll reduce that harsh brightness without making things too dark or messing with your color perception. Okay, now for a couple of nice-to-have features. These aren't essential, but they can make a big difference. Wraparound frames are fantastic because they block light, wind, and even dust from sneaking in around the sides. And polarized lenses, well, they're a great optional upgrade, especially if you drive a lot. They're amazing at cutting the glare that reflects off of surfaces, like a wet road or the hood of a car.
Next up, the application. Because it's not just what sunglasses you choose, it's also about when and how you actually use them.
Now, first and foremost, always follow your surgeon's specific advice. But a good rule of thumb is to be really consistent about wearing them for the first few days and weeks. After that initial period, just make it a habit. Anytime you're outdoors in the sun, pop them on, and definitely wear them on windy or dusty days to give your healing eyes that extra layer of protection.
This is a big one. It's a question we hear all the time. Do you actually need to wear sunglasses when you're inside? And the short answer is no. It's not usually a medical requirement. But hey, if you find bright indoor lights or the glare from your computer screen a little uncomfortable in those early days, it is absolutely okay to wear them for some temporary relief. It all comes down to your personal comfort. All right, let's quickly cover the pitfalls. I want to go over a few common mistakes just so you can sidestep them completely. Mistake number 1, picking style over substance. Yeah, those cheap fashion sunglasses might look great, but if they don't have that crucial UV 400 label, they are failing at their single most important job. Mistake number 2 is thinking that darker lenses mean better protection. Remember, the tint is for comfort, but the invisible UV coating is for protection. They are two totally separate things. Mistake number 3, not bothering to wear them for short trips outside or on cloudy days. Just make it a simple habit. If you're heading outside, you grab your shades. Finally, mistake number 4, using an old, scratched-up pair of sunglasses. I mean, come on, you just invested in getting crystal clear vision, so the last thing you want to do is look at your beautiful new world through a hazy, damaged lens. Okay, let's bring it all home with the takeaway. So just remember, your sunglasses have 3 really simple jobs: to cut down on glare and sensitivity, to shield your eyes from UV exposure, and ultimately, to just make your day-to-day activities more comfortable while you're healing.